welcome. My name Agre Kevin. So I'm going to talk about different things concerning child health in Kenya. I'm going to talk about stakeholders and their roles in ensuring that they improve the health of the children. I'm also going to talk about challenges that the stakeholders might meet when addressing the issue. So the aim of intervention that I'm making is to ensure that child health is improved in Kenya, because we have seen that the numbers are keeping improving day in, day out. This creates an health concern to everyone. So I'm starting about the key stakeholders. Among the key stakeholders, we say that we have a general practitioner. This is a doctor, a family doctor, who who helps to deal with child health in general. So if there is a possibility, these family doctors can help to educate people about child health. Another key stakeholder is health visitors. Health visitors are services of all families under the age of 5. Those are visitors help to visit children around each home to ensure that they help the parents to understand some key things that they need to do to their kids, for example, the nutrition and so on. The most also significant about this child health is school nurses. School nurses, they help provide services to children at school. They offer advice, supportive, and on health-related issues and topics. Maybe they can get topics such as obesity, misuse, sexuality, and so on, emotional health, and so on. Clinical psychologists, those are the health professionals who help children and young people in specific with learning behaviors and difficulties. These are among the key stakeholders. And let's now talk about um, challenges that they may encounter. You see, like when you are looking at resources, the government of Kenya and the people may be poor because of other determinants of health, like we said, the lack of education, poverty, and also different things like in sanitation and so on, hygiene. Those those ones are still a problem, because these key stakeholders, they are not going to deal with this all of the problem, but they are going to focus more about helping the kids. So, but the issue of poverty still remains. The issue of poor living standard still remains. So, the another thing we'll talk about, how are we going to measure the progress of this, or how are we going to assess the the intervention that we have done. So it says for intervention to be successful in Kenya, it has to be implemented in levels. So we should have like both in public and private facilities, because this will help people to get more informed and also to get much information about different issues. The process of evaluation should be conducted by one of the key stakeholders, which is going to train and related also supervise care in governmental agencies concerning the health. So they are trying to talk about one of the things that we have to consider when we are evaluating if the intervention is going to work or not going to work. Because we have seen that child health more so focuses on children, the way of living, and their environmental, those factors that help their physical, mental interaction, and social and emotional health or well-being of those kids. So to evaluate effectiveness of this intervention, they should be conducted in levels, in hospitals, whereby they will go to see how effective it has been. So the last thing I'll talk about is all about recommendation about this concluding of this project. So I'm recommending that since the intervention may require a lot of resources, it also may require health professionals from different levels. It could be fine that um, all all stakeholders and government, both government and private institutions, to work in collaborations so that they can mobilize some resources from maybe World Health Organizations and other key stakeholders like Doctors Without Borders and so on, so that they help them in improving these things. So I would like to recommend them that the government and the institutions mandated to child health to work hard, and also to ensure that everything is everything is in place and everything is acquired for child health, because if the number is keeping growing, it creates a lot of health concern. Thank you for watching this video. I think it will help you to learn more about child health in Kenya and the ways we can able to tackle them.